I've trained at some of the bigger programs, and I've been at some of the biggest programs across the country, and the quality of care that we deliver here is equal to or better than some of the other places. I mean, I think the quality of care across the line is good, but in terms of attention from attending and resident physicians on a personal level, it's much better here. I mean, you actually get to see the people who are taking care of you. It's more of a, I don't know how to put it, a big city endeavor in a small town. I mean, it's just got the small town twist to it. The quality is as good or better. If you look at our outcomes across the state, we're in the top 10% across the state, even compared to the largest centers.
I chose to come to Johnstown. I was at the University of Illinois at the Carle Clinic in Champaign for 15 years. I was chief of surgery there for 10 years. I was director of trauma for Joint Coalition Naval Forces for the invasion of Iraq as part of the 3rd Fleet. And when I came back from there, I decided to back away from some of my administrative responsibilities. And a headhunter actually recruited me out here. I interviewed in Johnstown in December and chose to come here because this is really a diamond in the middle of western Pennsylvania that most people don't know about. It's a 1,000-bed hospital with all the capabilities that one would ever want, including the major residency programs, and the ability to do research and the ability to do state-of-the-art surgery.
We bring a wealth of training from both the Cleveland Clinic and Case Western Reserve, which is also in Cleveland, to Memorial Hospital. And I think that my experience in the military before I came here adds to that. I think that I tell my patients that we have trained in some of the best university programs in the country, and we have chosen to practice in Johnstown to allow them to have the best care that they can and stay home. I've always been impressed with the caliber of care at Memorial Hospital, and we have some of the best trained physicians, nurses, and ancillary healthcare providers in the state and in the country, I'm sure. And this is just proof that although we may not be a university program in a major city, that our patients get some of the best care that is available to them.
Well, when we built the new building here about 10 years ago, Dr. Duke and I were charged with bringing what's called a minimally invasive surgery rooms to the operating room. We spent some trips going to other minimally invasive operating rooms and trying to take the best out of their rooms and develop our minimally invasive rooms. Presently, we have 6 or I think 5 or 6 operating rooms that are all geared for minimally invasive surgery. So everything's built into the walls and ceilings. The nurses don't have to run over cables or towers or anything like that. And it makes it flow very easy for the patients and for the people that are working here.